Everyone, welcome to my YouTube channel. I am Nurse Patience. In today's video, we'll be talking about pelvic inflammatory disease. What is pelvic inflammatory disease? Pelvic inflammatory disease is a sexually transmitted infection that affects women in their reproductive tract. Before I continue with this video, please, if you are new to this YouTube channel and you are yet to subscribe to this amazing YouTube channel, please kindly hit the subscribe button. If you are a returning viewer and you are also yet to subscribe, please do well to hit the subscribe button and turn on the notification button to help you get notification from us whenever a new video is up. So, pelvic inflammatory disease is an infection of the reproductive tract. It usually occurs when sexually transmitted bacteria or organisms are being transported from the vagina through the cervix to the uterus to the fallopian tube. Even the ovaries are affected with this infection. Anybody, any human in her reproductive age can get PID. So this video is a must watch for every young lady out there, for every man who would definitely have something to do with a lady, because most individuals that have PID, they don't show symptoms of this particular infection. So what are the signs and symptoms of pelvic inflammatory disease? One of the signs and symptoms is pain. This pain ranges from mild to severe. For individuals who have PID, some of them tend to complain of mild abdominal pain or pelvic pain, while some complain of moderate pain, others might complain of chronic and severe pain. The next is bleeding, irregular bleeding between periods. Individuals who have PID might experience bleeding, uterine bleeding, in between their normal regular period, and this also can mess up with the entire menstrual cycle of the individual, as it tends to make the menstrual cycle irregular. Unusual vaginal discharge. Individuals who have pelvic inflammatory disease tend to have unusual vaginal discharge. Some of it might be foul smelling, so you have to watch out for vaginal discharge too if you have PID, or you just watch out for your vaginal discharge generally. If it becomes unusual and becomes odorful, then it could be that you are having PID. Another is pain during or after sexual intercourse. Individuals who have PID tend to complain of pain during coitus. This is a classic sign of PID. Then there's also painful frequent urination. Individuals who have pelvic inflammatory disease, some of them might have painful frequent urination, but one thing that is common with all of them is they tend to urinate more frequently. The next is fever. Individuals who have pelvic inflammatory disease tend to have fever. Up next, we'll be looking at what are the causes of pelvic inflammatory disease. Pelvic inflammatory disease can be caused by a variety of bacteria, but basically, pelvic inflammatory disease is caused by Neisseria gonorrhea, which is a causative organism for gonorrhea, or chlamydia bacteria. So these are the two most commonest organisms that cause pelvic inflammatory disease. Upon culture, individuals who have pelvic inflammatory disease, most of them who go for culture and sensitivity tests in those standard well-recognized laboratories, these are the two most common organisms that are being found after culture. Although pregnancy, abortion, miscarriage can also trouble the cervix, which will pave way for some of these opportunistic organisms to find their way into the reproductive tract of such an individual, further causing them pelvic inflammatory disease. Pelvic inflammatory disease can also be caused by use of intrauterine device, which is IUD. Individuals who have IUD on or use intrauterine device are of higher risk of coming down with pelvic inflammatory disease. What are the complications of pelvic inflammatory disease? As I told you earlier from the beginning of this video, pelvic inflammatory disease can affect anybody, any woman in her reproductive age. Provided they are sexually active, then you are fit to have pelvic inflammatory disease. So it doesn't mean that there's a particular category of people who are prone to PID. So if you're a woman, you are sexually active, then you are a number one candidate for this particular infection, because if you are sure of your status, you are not sure of the status of your mate, that's your sexual partner. So that your sexual partner might be having any of this bacteria, which can actually cause you PID. If you people should meet after intercourse, there is a higher possibility that you would have PID. PID, if left untreated, can cause numerous disastrous activities in the body, and I'll be sharing a few with you in this video. One of it is ectopic pregnancy. Some of you must have heard of ectopic pregnancy. When you hear ectopic pregnancy is usually pregnancy or implantation of the embryo outside the uterus. So any pregnancy that is outside the uterus, it is ectopic pregnancy. Every normal pregnancy is supposed to be implanted in the uterus, but once it is ectopic pregnancy, it is usually outside. So such a pregnancy can be on the fallopian tube. How do ectopic pregnancy and PID relate? How do they relate? In pelvic inflammatory disease, if left untreated, it causes scarring of the tissues of the reproductive tract of such an individual, making and causing blockage for this embryo to travel to the uterus. So when there is PID, the embryo would not travel to the point where it's supposed to get implanted in the uterus. Rather, it will stop at the fallopian tube, which is not right. The next complication of pelvic inflammatory disease is chronic pelvic pain. PID is left untreated. At first, it might start presenting as mild pain, but with time, it will graduate to moderate and then to severe. This severe is now the chronic pain. If you leave PID untreated for so long in your body, then you tend to have this chronic pelvic pain, and most times it is usually unbearable. The next complication is infertility. PID, if left untreated, first I said it could cause ectopic pregnancy. Ectopic pregnancy is one of those abnormalities in pregnancy. If you keep having ectopic pregnancy, that means the chances of carrying a baby in the uterus is very slim. And once the scarring of the tissues of the reproductive tract of such an individual, it makes fertility difficult. So having PID untreated would put you at a higher risk of infertility. So if you have PID, please go and get tested and treated so that you'll be able to conceive the normal way you should. Then the last but not the least is tubal ovarian abscess. By tubal ovarian abscess, one of the symptoms of pelvic inflammatory disease is unusual vaginal discharge. These discharge are coming as a result of these abscess that have accumulated in the uterine lining. By abscess, I mean collection of pulsy or infected fluid in a particular space. So tubal ovarian, that's the fallopian tube and the ovaries, tend to have this pulse filled fluid in them, which will further prevent conception. Most times, individuals who have chronic PID, the results, or for them to get full treatment after attempts with antibiotics, they tend to go for flushing, which will help take away all those organisms that have been trapped, and even the fluid, to help flush those fluid. Prevention of pelvic inflammatory disease. One thing I need you to know in this video is pelvic inflammatory disease is curable. There is a solution to it. It can also be prevented. You can stay as an individual without having pelvic inflammatory disease. Or if you once have pelvic inflammatory disease, you can get cured of it. You would prevent yourself from coming down with pelvic inflammatory disease in the future. So one of it is safe sex practice. By safe sex practice, all I mean is before you have any form of sexual intercourse, you try and use condom. With this, it will prevent or reduce the chance greatly of coming down with pelvic inflammatory disease, as those fluids from your sexual partner will not be coming in contact with you directly. Request that your partner gets tested from every form of STI. If it's a man that is watching this video, please go and get tested. Also get your female partner to get tested. You both should get tested so that you'll be able to know your status. If there's any complication or any bacteria is seen, then treatment will be commenced immediately. The next is do not dodge. Watch my video about keeping a healthy vagina. For your vagina to be healthy as it should be, and preventing any form of bacterial entry. If you dodge, then you are trying to make that pH with the vagina also keep to become high, which will make your vagina pH to become alkaline. So when you dodge, you destroy that protective covering that the vagina have for you against some of these infection. Then what are the treatment options for pelvic inflammatory disease? The treatment options for pelvic inflammatory diseases, one of the major way you know you have pelvic inflammatory disease is to go and get tested. If you are not tested, you would not know what organism is actually responsible for it. If you have pelvic inflammatory disease, you have gotten yourself tested, then you know the particular organism. The treatment option will it ranges from antibiotic treatment to vaginal suppositories for the female counterpart. Example of this antibiotic is you might be giving doxycycline, for example, 100 mg BD for you to take. Then the vaginal suppository would be inserted into the vagina only at night, the last thing you do before you go to bed. It could contain antibiotic, broad spectrum antibiotic, and lactobacillus, which is very important for the vaginal pH maintenance. For the male counterpart, you would also be placed on antibiotic medication for 10 days to help clear this infection away. And after this is done, it is also required that you go back to check. Go back and check with your O&G doctor to see if infection have truly cleared, completely cleared. If there's still traces of infection, then and the infection is a resistant one, such an individual might further go for flushing. That's for the female counterpart, whereby these organisms will be taken out of the body entirely and the person will be left free, whole and hearty again. I don't know if this video has been helpful to you. If it has been helpful to you, please do not forget to hit the like button, give this video a thumbs up, drop comment on this video, and if you are yet to subscribe to this channel also, kindly hit the subscribe button and do not forget to turn on the notification. Thank you.